Well, good afternoon, everyone. My name is Mauricio Vera. I'm the Assistant National Director of the Veteran Institute for Procurement. I would like to welcome and thank you for joining us for today's webinar. Today, we're going to hear about recent trends in COVID vaccine and mask mandates for employers. Obviously, a very, very important topic these days. And today's webinar was developed to help veteran-owned businesses accelerate growth in the federal marketplace. As many of you know, VIP offers 4 different curriculums to give veteran-owned small businesses the tools they need to win government contracts. Participants receive hands-on, market-based instruction that helps establish best business practices for federal government contracting, and the program is offered at no cost. So for additional information, please visit our website at www.nationalvip.org. Today's webinar is brought to you by the VIP in partnership with the SBA and the Veterans Business Outreach Centers, or VBOCs. The slides and video recording from today's webinar will be emailed to you. And now it gives me great pleasure to introduce our distinguished speakers for the day. And that's Nicole Atala and Sarah Nash. Let me tell you a little bit about them. Nicole Atala counsels employers and their compliance professionals in a broad range of labor and employment matters, including employment discrimination, wage and hour, family and medical leave, labor union negotiations and grievances, executive compensation, and reductions in force. Nicole's primary goal in representing employers is to help guide them through difficult situations, proactively address compliance, and avoid costly disputes. She serves as the practice group chair for Pilero Maza's Labor and Employment Group and co-chair of the firm's construction industry team. We also have with us today Sarah Nash, who advises government contractors and commercial businesses on a wide variety of labor and employment issues, including the Fair Labor Standards Act, the National Labor Relations Act, Office of Federal Contract Compliance Program regulations, and anti-discrimination law. Her practice includes counseling employers on terminations, labor relations matters, employment agreements, wage and hour issues, and employment practices and policies. Sarah regularly advises clients on compliance specific to government contracting, including offering counsel on prevailing wage laws such as the Service Contract Act, codes of ethics, and equal employment opportunity requirements. So again, welcome to Nicole and Sarah. Just for everyone, please feel free to submit your questions throughout the presentation in the Q&A box, so not the chat box. So remember that on the Q&A box, and that can be found in your Zoom toolbar. We will also have a few minutes at the end for more Q&A. And now, again, I want to welcome Nicole and Sarah. Thank you for supporting VIP. It's all yours.
Yeah, thanks, Mauricio. I appreciate it. And it's nice to be here with you all today. We are going to cover a broad range of topics that relate to the vaccine and mask mandate. I know this is on top of everyone's minds. It's we probably could have told Mauricio to truncate our bios because the last month it's really just been vaccine. But you know, all kidding aside, we know that this is very challenging for all of you all. So we're going to talk a little bit about what has happened since the summer with the Biden administration and where we are now. We're going to talk about different regulations that cover COVID vaccination policies so that you all know, to the extent you have employees or you are subcontractors to a prime, what you need to be thinking about. We will explain what's included in this vaccine mandate, what it is and what it isn't. And then we'll talk about accommodations, because the only exceptions, if you're covered by this vaccine mandate for federal contractors, the only exceptions are going to be for medical or religious, sincerely held religious beliefs. And then we're going to talk a little bit about how state laws might impact these regulations and other things to think about. So we're going, you know, it's a lot to cover, but we are going to get through it in the next 50 minutes or so. And obviously, if you have specific questions, let us know.
Thanks, Nicole. So how did we get here? As we all know, we've been in the COVID pandemic now for about 18 months. time flies when you're, stuck in quarantine. And recently, the Biden administration has issued a number of mandates and plans, making clear that they have a very clear priority to get as many individuals vaccinated as possible. Currently, about 3/4 of the vaccine eligible population, those are any individuals who are over the age of 12 at this point, though that might change in the coming weeks, are currently vaccinated or have at least received one dose of one of the COVID-approved vaccines. This means that a lot of companies are looking to return individuals to the work site. People have been working remotely, and a lot of companies are looking to change that to get to a, quote, return to normal. We'll talk a little bit about why that's sort of a false, some kind of a misnomer. What is normal? Probably it's not going to look like things did before March of 2020, but it will look something similar, hopefully, with folks in the office. Some of this was a little bit complicated by the impact of the Delta variant. When the Delta variant began spreading through communities, there were some changes. As you'll notice, there are a lot of changes that are kind of in reaction to where the pandemic is going, what COVID is looking like. The Delta variant is one of those sort of curveballs. Originally, the goal of the administration was to get to this 3/4% vaccinated population. However, they have since increased that goal in an attempt to stop the Delta variant, which is a little bit more virulent and transmissible than some of the other variants out there. So according to the CDC, fully vaccinated individuals can resume activities, but must continue wearing masks in areas with higher substantial transmission. This is part of the Biden administration's reason for wanting to get the individuals vaccinated. It should be easier to return to normalcy when you have more individuals vaccinated, is sort of their party line. However, as many of you probably know, there are a lot of folks out there who are still hesitant about getting the vaccine, whether it's because of unfamiliarities with some of the side effects or a religious reason. We'll talk about religious and medical accommodations later in this webinar, but for whatever reason, not everybody is lining up to get the vaccine. And so the administration has made very clear that they want to create some incentives, some carrots and some sticks to get people to get vaccinated. And so we're going to look at some of the policies that have been implemented in the past, at this point, 3 months or so, that are trying to increase the number of folks who are fully vaccinated. One question that companies are trying to sort of juggle is whether they should individually, as a company, implement mandatory vaccine requirements. For the government contracting crowd, this question was really overshadowed by the recent Biden administration announcement back in September that they would be requiring certain government contractors to get their workforce vaccinated. We're going to talk at length about what the sort of construct of that mandate is, how it applies to contractors, how it applies to contractor employees. But it sort of took the decision in large part away from a lot of companies who are engaged in business with the federal government, because now there is a mandate that they comply with certain requirements. And so this is sort of the context that we're looking at these mandates in, and looking at how companies are going about determining whether they want their workforce to be vaccinated or need to require their workforce to be vaccinated.
All right, so let's think about way back in July, which seems like it was 3 years ago at this point, but way back in July, the Biden administration announced its first attempt at getting folks vaccinated, at least those that were working on site at government facilities. And what they did in July is they issued a policy directive that was supposed to be flowed down through the agencies, and they established this, what they're calling the Safer Federal Workforce Task Force, which I have my opinions about that name at this point because that's really hard to say. But it's the Safer Federal Workforce Task Force. And it's important to remember that in the context of where we are now with this new FAR provision. But what they basically did in July is they issued these model safety principles, which were to be adopted by federal agencies. So they were policies. They weren't, it wasn't a FAR provision that had to work its way into contracts. It was a policy that each agency promulgated that it impacted on-site workers. And what it said was that you had to sign this attestation form that said, I'm vaccinated, I'm not vaccinated. And if you weren't vaccinated, you were supposed to test within 72 hours of being on a federal work site. And different agencies implemented that in different ways. And you were supposed to wear masks indoors if you were working in a certain locality with a high transmission rate and in accordance with CDC guidance. It was not subject to any government-wide restrictions on official travel or anything like that. But what our clients saw was all of a sudden these forms floating around, and their employees had, if they were going to be working on site, had to make sure that they had one of these attestation forms in order to access the site and the facility. And that employees and on-site contractors who were not fully vaccinated or were not going to attest. So even if they were vaccinated, they don't want to tell anybody what their vaccination status was, or they didn't fill out the form, they were essentially treated as unvaccinated. And if you were unvaccinated, you had to submit to frequent COVID testing. Some of that was provided through the agency, although that has been pulled back at this point in large part, given the current developments. Most contractors had to make sure that employees went and got tested within 72 hours of getting on site, and they had to carry their negative test results with them. The reason why this is really important is because these policies that have been issued by agencies have not gone away, right? So we wanted to set the stage for this idea that these policies are still here. Even when we get to the mandate stuff, these policies don't go away. And that helps us with some of the reasonable accommodation considerations later.
So a couple months after the Biden administration announced this sort of worksite access requirement, they went not just a few steps further, but like many, many steps further. Biden announced on September 9th that he would be initiating a series of policies aimed at getting as many individuals vaccinated as he was able to within his authority as president. One of those requirements, and the requirements listed on this page have not been implemented. They are coming. You do not know when. I would guess in the next few weeks. There are really three parts here. One is that employers with 100 plus employees, so any employers with more than 100 employees, will be required to ensure either vaccination or weekly testing. This should sound familiar to what Nicole was just describing in terms of worksite access for government contractors. You either get the vaccine, presumably a test that you have gotten the vaccine, or you're subjected to weekly testing. This will be promulgated in a kind of rulemaking from OSHA, where they will enact an emergency rule that is anticipated to come out in the next few weeks again, that will sort of describe how this requirement is going to be applied. It has not been applied yet. It will apply to private employers and government contractors to the extent that there's sort of overlap in that government contractors do have more than 100 employees. And it will require some type of mechanism for ensuring one of these two boxes has been checked. Either people have been vaccinated or they're subjected to weekly testing. Another requirement that will go into effect that we really don't have much details about is that employers will be provided to provide paid leave to employees in order to get the vaccination. We don't know at this time who's going to be responsible for paying for that paid leave. We do not know if a company's current PTO policies will address that requirement and be considered sufficient to satisfy the requirement. So we're just in a wait and see pattern. Previously, sorry, this slide should have been updated. As of September 30th, the Families First Coronavirus Response Act is no longer in effect. Previously, employers with covered employers were entitled to essentially a credit that they would receive for providing certain paid leave in connection with COVID. That's no longer available. And so when this new requirement goes into effect, we're going to have to see if the government provides an additional credit or if this is really going to be coming from the bottom line of companies. Lastly, there is a requirement that requires vaccinations for certain healthcare workers who are working at Medicare and Medicaid hospitals and healthcare settings. And that will be under CMS sort of general jurisdiction. So we'll see how that is expanded over the next few weeks. As you know, if you work in the healthcare industry, there have already been some requirements that have been imposed by stricter COVID regulations. So it's just important to keep an eye on those. The announcement from the administration that's really probably relevant for those in attendance today is going to be the federal contractor requirement that Biden announced that really imposes vaccination requirements on federal contractor employees. And we'll talk a little bit about exactly how those requirements apply. It's not completely across the board, but it's broader than you might expect. So I think, Nicole, you're going to kick it off with kind of discussing some of the types of timing that we're looking at here.
Right. So we wanted to really talk about timing quickly on this, because I think that's front and center in everybody's mind, right? When does all this stuff go into effect? Because this mandate is applicable to federal government employees as well as contractors. And there's been some confusion as to, well, when do we have to get our first dose? When does everybody have to be fully vaccinated? So essentially, as of this week, as of tomorrow, agencies are going to start incorporating this new FAR provision. And all the new FAR provision says, by the way, is follow the Federal Safer Workplace Task Force, blah, blah, blah. I can't even say it. It's been so many times.
Task force.
We need a new nickname for this task force. Let me put it that way. And it just says follow that guidance, right? So the FAR provision is going to start working its way into covered contracts. We'll talk about what that means in a second. And we've already, frankly, seen it happening. So this is, agencies are not waiting for tomorrow. Let's put it that way. GSA has started issuing modifications. Agencies have started issuing agency-wide declarations that all of their contracts are going to be modified at the same time. So this FAR clause is going to start working its way into contracts as like now into the future. It could be modified into your contract kind of, spontaneously by a contracting officer, right? They could just decide that they're going to modify a contract that's covered. They can decide that they're going to do it at option years, and you're going to start to see it in new solicitations. What you want to keep in mind, though, is that the reason why the December 8th, and you'll see that at the bottom bullet point in the slide, the December 8th deadline is important because that's the deadline for contractors to basically have a grace period between now and December 8th, giving you lead time to get employees vaccinated, okay? So if your contract is modified tomorrow, your employees will still have until December 8th to be fully vaccinated. And fully vaccinated means 2 weeks after the last dose of the vaccine. Moderna has the longest lead time. You essentially need 6 weeks from your first dose and into 2 weeks after your last dose in order to be considered fully vaccinated. So if you back that up, you're basically looking at early November, late October, early November to get your first dose if you get Moderna. If you get Johnson & Johnson, you have basically a 2-week turnaround. It's 1 dose, 2 weeks after your first dose, you're vaccinated, right? But if so you kind of have to kind of start thinking about this, because essentially after December 8th, if your contract is modified, you have no grace period to get employees vaccinated, right? So the requirement does not technically apply to you until the FAR provision makes its way into your contract. But if your contract is modified on December 15th, you need to be compliant on the effective date of the modification, December 15th or December 16th. So if you've waited thinking, well, I'll just do this whenever my contract is modified, and you have a couple of people that aren't vaccinated and that don't have an approved exemption, you are technically in non-compliant with the terms of your contract, and therefore in violation of the terms of your contract immediately. Those people are not authorized to work on that contract anymore. That's another way of saying it, right? That they are not authorized to do any work on that contract because they don't meet the contract requirements at that point. So that's why this timeline is really important and why everyone is rushing to figure out what are we going to do and how are we going to handle this, because this timeline is upon us. It's now.
The time is now.
The time is now.
And we'll talk a little bit about some of the states out there that make that timing a little bit more complicated, but that is a future slide. So let's address who exactly is going to be covered by this requirement. We've gotten a few questions that are addressing those same issues. I'll try to address them here. First of all, unlike the private mandate that will go into effect under the emergency rule in the coming months, weeks, this requirement does not have an employee threshold amount. If you are a contractor who has a FAR clause incorporated into your contract, that FAR clause is FAR 52223-99, this will apply to certain employees. It's not going to apply to all your employees necessarily, but you are going to be a covered contractor once the FAR provision is incorporated into your contract. As Nicole mentioned, some contracts are required to get this FAR provision. That said, there is an option for a lot of agencies to incorporate it either where they do not have an obligation to incorporate it or sooner than they would need to incorporate it. And so it's important to keep an eye out for it and to have an understanding of when you might be held to comply. I'm going to talk a little bit about the types of employees who are covered. There's really, the way I think of it is there are two types of employees, maybe three. One is going to be employees who are working on or in connection with a covered contract. Again, that covered contract is going to encompass any contract that has this FAR 52223-99 in it. If that FAR provision is in your contract, then any employees who are providing work on or in connection with that contract must either be vaccinated or have a reasonable accommodation that is either a medical accommodation or a religious accommodation. This will encompass employees who are working remotely. If you have employees who are working directly on that contract, even if they never go onto a work site, even if they stay in their house, never leave, they are required to get the vaccination. It will also apply to your back office support folks who are working in connection with a covered contract. If you've read the guidance, and I suggest that you do because there's a lot of FAQs in there that are addressed, what in connection with applies to would be those payroll support employees, those HR employees who are spending time essentially performing services that are not directly on the contract, but are indispensable to performance of the contract. And so that's going to include HR, payroll, anyone who's performing work that you really need in order to perform that contract would be included. While the requirement is that this be incorporated into services contracts, there is a broader option for it to be incorporated into other types of contracts. And so just because employees aren't working on a service contract doesn't mean that they're automatically exempt and you don't need to worry about this. Really, the only two groups of employees or types of contracts that are exempted from coverage here are going to be contracts that are performed outside of the United States and contracts with certain Indian tribes. That does not include, for the record, Indian tribes that are part of a separate company that has been performing work with the government, sort of a very narrow exception. I went over that first group of employees. There's a second group of employees that's going to be any employees who are working alongside those individuals who are working on or in connection with a covered contract. I'll give an example. If you have a headquarters, you have some individuals performing work on a contract, anyone who is working alongside those employees must also get the vaccine. So just because they're not working on or in connection with a contract does not necessarily mean that there's no vaccination obligation. There are some exceptions, right? For example, if you have an employee who has maybe commercial side of the business, really has nothing to do with government contracts and is working remotely, that employee does not need to get vaccinated. Similarly, if you have an employee on a contract who is, the FAR provision has not been incorporated into that contract, no obligation to get the vaccine for that individual employee as long as they're not working alongside other employees who are working on a covered contract. So that kind of goes over which employees are covered, which employees are not covered. There is some gray area out there about what it means to work on or in connection with a contract, but generally it is a broad reaching definition. And so it is going to apply to some of those back office support overhead folks.
Right. So I think the crux of the matter there, Sarah, is this is broad ranging. And if the contracting office wants it included, they're going to include it. And that is kind of what we've seen so far, particularly out of the GSA and some other agencies that have indicated that they are going to apply it to a broad range of contracts that extend beyond services contracts. And that, you know, the biggest consternation we see is remote workers. You know, like, who am I harming? Well, you have to keep in mind that this isn't necessarily a FAR provision to prevent spread on federal workforces. It's to get as many people vaccinated as possible. So you have to kind of think back to the reason this is being implemented the way it's being implemented. You have to verify vaccination status. So I got a call earlier today and my client said, Nicole, I don't really care as long as I just have to tell my employees they have to do this, but I don't have to do anything else. And I said, well, it's not quite that easy. The FAR provision requires that you verify employees' vaccination status. You can't use that self-attestation form that was out there before. You've got to actually see the card or see some sort of vaccination record that indicates that someone's been vaccinated. There is no requirement that you keep a copy of that record, but if you think about how this is likely to be enforced through complaints to the IG or False Claims Act saying, hey, my employer is not enforcing this mandate, an IG investigator walks in and says, well, show me the vaccination cards that you checked. You'd better either have a copy of that vaccination card or some other document that someone signed off, kind of like you do with I-9s. And you say, hey, I inspected this document on this date. I verified that it was, you know, as accurate as you can have some sort of statement that says I checked their vaccination record on this date at this time. If you don't want to keep a copy of the actual vaccination card or vaccination record, but you do actually have to check it. You want to make sure when you do that, that you don't have people just emailing you their vaccination cards and then you keep it on your email system and it's not deleted off of there, okay? So it needs to be kept in the same way you would keep medical records generally, because this is considered a medical record. So there should be a separate folder in the personnel file. I recommend that it is taken off of email and you double delete that email. Some clients are using SharePoint files for employees to upload vaccination cards. And as long as that person can't see everybody else's vaccination status when they're logging in, you'd probably be okay doing that. But you need to make sure that you come up with a system to check vaccination status and to record vaccination status. You also will have an obligation to flow this down to any subcontractors that have contracts above the simplified acquisition threshold. So if you have a 1099 working for you that has a small contract, it's expected to be $15,000 over the life of the contract, that contract is going to be below the simplified acquisition threshold. And as long as we're very confident that that worker is properly classified as an independent contractor and it's not actually an employee, then you don't have to flow down the obligation to that person. But any subcontract that's above the simplified acquisition threshold will need to receive a flow down, and that would only apply to services contracts, not other types of contracts. Masking, I think this one I'm taking over your shtick, but a lot of contractors have asked me, well, Nicole, do I just make subcontractors follow my policy? Well, we don't want to be a joint employer with the subcontractors. We want to be careful about how closely we monitor this type of compliance. But you can give them a heads up. You can say, hey, this is how we're implementing it. You will be required to do this, and we will provide the flow down when we get it. So as soon as your contract is modified to include this FAR provision, we will flow it down to you, and they will then need to certify that they are in compliance, or at least they'll have that obligation in their subcontract at that time.
There's also a masking and social distancing requirement. This is probably overshadowed by the vaccine requirement because that's such a big lift, but contractors also have an obligation under the FAR provision, under the guidance, to implement certain masking and social distancing requirements. They also need to designate a so-called workplace safety coordinator who is responsible for monitoring community transmission rates. They provide a website URL in the guidance that is supposed to be checked on a weekly basis to evaluate whether there's high transmission in the area where the contract work is being performed. If there are masking obligations for even vaccinated individuals indoors, with some exceptions for different types of activities. If you're engaged in a highly physical work, there may be an exception out there for you. The masking requirement will apply all the time for unvaccinated individuals. Perhaps they are visitors, or they have received an accommodation from a contractor that is permitted under the guidance. But it's important to keep an eye out for those additional requirements, because it does go a little bit further than just requiring employees to show proof of vaccination. And we went over the deadline for compliance, December 8th, as long as it has been incorporated into your contracts, which it seems that agencies are doing this really at a fast rate. So the likelihood is that it will be incorporated sometime prior to December 8th. There are some exceptions, though. So just keep an eye out for that modification if it comes in.
All right. So what don't we know? Well, frankly, we don't know a lot, because the guidance that's been issued is not very well written, frankly. There are a lot of holes and gaps in it. And if you think about the ways that we normally implement executive orders, there's usually some sort of regulatory guidance that is issued, or rules that are issued. There's an opportunity to comment on those rules. There's a long lead time before they're issued. Folks can prepare. Obviously, if they did that in this case, hopefully, cross fingers, the pandemic would be over by the time they got this issued. So they didn't have the gift of time. They wanted to get a vaccine mandate out as quickly as they possibly could. And so there are some missing pieces. There are some things we don't know. Employers are still trying to figure out how to respond to medical and religious accommodations. And we're going to talk about those in a minute. I know there are questions about those. Basically, the guidance that we have is apply what you already know about medical and religious accommodations under Title VII and the ADA. What's unknown is how clients are going to respond to those accommodation requests. Some agency clients have already said, we are not going to consider accommodations at all. We don't believe there is an accommodation for a federal contractor. My hunch is that most contracting officers are not going to get involved in that decision. And this is where we talk about that July policy overlay. My hunch is that if you approve a vaccinate, or if you approve an exemption from vaccine, and that person is working on site, you will then have to have that on-site person comply with whatever policy is on site regarding testing, masking, et cetera, right? So that policy will still overlay over the top of the vaccine mandate for those people that have a medical or religious accommodation. However, you should also note that if you're ever investigated for non-compliance, you need to make sure that you can demonstrate a good faith effort. And I've been using this extreme example that's a little silly, but it essentially, if I believe in rocks and I say, well, I don't want to get vaccinated because rocks don't get vaccinated, and I believe in rocks, and IG is going to say, you didn't evaluate these in good faith. You essentially granted anybody who wanted an accommodation, even if you had sincere questions about whether or not they were putting forth bona fide requests for medical or religious accommodations. So you should be asking yourself, does it pass the smell test? If somebody looked at this, an investigator looked at how I was processing these accommodations, would they say you made a good faith effort to comply with the mandate? And that's what an IG is typically going to be looking for. We also, as Sarah pointed out earlier, there are some questions about how broad the honor and connection with language is. Can somebody basically come in and do payroll for 2 hours on, a month or something and still be in connection with a covered contract? How far does that reach? That's jury's still out on that, but we believe, based on some other executive orders and FAR provisions that have gone into effect, that this is pretty broad reaching. Another unknown is when agencies will decide to incorporate the new FAR clause. They seem to be doing this very proactively in advance, often, of the option years on contracts. So it's really going to be dependent on what contracting officer you have or agency that you have a contract with and what their position is on incorporating the FAR clause. How will companies be subject to the testing alternative? Will companies be expected to pay for testing if somebody has an accommodation and they're required to test in order to work on site? Does the employer have to pay for that? The Department of Labor has not yet answered that question, although they have indicated in some cases that it could be considered a required test. And if it is considered a required test, there's some support for the proposition that companies might have to pay at least for the time off in order to get the test. And you can always send people to free testing sites. We don't really have the end answer on that particular question, or frankly, whether you have to pay for the time to get vaccinated. California state law basically says the answer is yes to both of those things, but we don't have a straight answer from the Department of Labor. So there is a risk there. And there is nothing in the executive order that talks to what the penalties or repercussions are. What we do know is how FAR provisions like this, for example, the FAR provision dealing with a code of business ethics and conduct, how these types of FAR provisions have been enforced in the past. And that's essentially through an implied certification argument that you have agreed to comply. So the government could terminate your contract. You could get an IG investigation that says you falsely certified your commitment to comply, and it could get a little bit messy. So we expect that it will be enforced through kind of employee policing and reporting, contracting officers requesting information regarding your compliance efforts, but there's nothing in the guidance itself that directs how this will be enforced.
It's a good opportunity to remind folks too that certain whistleblower disclosures are protected disclosures. So if your employee notifies you that they believe you're being non-compliant, the reaction is not always going to be, we'll terminate them. Sometimes they can be disclosing some protected issues if they reasonably believe them to be in violation of a regulation. And so just keep in mind that added obligation as a contractor. So a lot of the questions that we receive from clients have been, really, can I require my employees to show me their vaccination cards? Can I require them to be vaccinated? Is this lawful? And there have been a number of regulations and guidance that have been issued from EEOC and OSHA that essentially confirm that yes, employers are permitted to verify that their employees are vaccinated and to require that as a condition of employment. Albeit there must be a reasonable accommodation for either medical reasons or sincerely held religious belief. Some states have, and I think we'll talk about this on a later slide, have issued their own local guidance, whether invalidating mandates or imposing additional requirements beyond just a mandate. And so it's important to check your local rules. You do want to note that there's really probably very strong case law that supports that this executive order from Biden will trump or supersede state laws contrary, but we can address that in a later slide. It's that under OSHA as well, there is a obligation to provide a safe work site. And so this will often come up in construction contracts where a lot of employees might be working in close proximity. Maybe it's difficult to be wearing a mask. There is an obligation in those circumstances to ensure, and in all circumstances, to ensure that employees are working in a safe workplace. And so to the extent that you are able to limit the spread of, or the likelihood of spread of COVID-19, you want to make sure that you have a policy in place that reminds individuals not to come to work if they're experiencing COVID-19-like symptoms, to encourage social distancing and masking in certain circumstances. This is just a quick timeline sort of for how a lot of these regulations have been rolled out. Last December, the EEOC first endorsed vaccine requirements for on-site work. In May 2021, issued additional guidance that basically says that employers are allowed to mandate COVID vaccination policies, of course, subject to those ADA and Title VII requirements. And OSHA has similarly been releasing a lot of guidance that is encouraging vaccine mandates and encouraging this mandatory use of mandatory policies. Again, we are expecting an ETS in the coming weeks that will implement Biden's announcement on September 9th that employers will be required, if they have more than 100 employees, to implement either a vaccine mandate or testing alternatives.
All right, so accommodations. There's several questions on accommodation. So this is accommodation. In general, if an employee refuses to be vaccinated with one of the available COVID-19 vaccinations, they will be subject to either to termination or sometimes long-term leave. They could be moved to non-covered contracts that aren't associated or working in the same facility as covered contractors. But what we do know is that they will not be authorized to perform work on a covered contract if they are not vaccinated, unless there is an approved accommodation. There is a kind of, we always want to put out an EEOC warning here, which is you have to permit exemptions based on the ADA and Title VII. That's the medical and religious accommodations. Under this executive order, those are the only two approved exemptions for an individual to say, I don't want to get vaccinated. And these are, there are legally protected reasons for not getting vaccinated. Usually we ask a physician to certify to that condition. So we'll say something like, a doctor's note might say something like, the person has a severe allergic or severe asthma, and if they did get a side effect from the vaccine, it could possibly kill them. So we recommend they not get the vaccine. Is something along those lines to assert some reason that's medically related or related to a sincerely held religious belief. What you want to be careful about is asking for too much information too soon, right? So when somebody says, I don't want to get vaccinated, the response generally should be, If you believe that you have a bona fide reason to ask for an exemption, either for a medical or religious reason, here is the form you can fill out. Please fill out the form and submit it to me. But if you start to inquire a little bit more about why somebody's not vaccinated, you could get genetic information or disability information that you really don't want to have and don't need to have. This is particularly the case when you are interviewing or trying to onboard new individuals into your company. So there might be circumstances where you're interviewing somebody and you want to know if they're vaccinated or not because you know you have this requirement. So what do? My recommendation is to say, this is the requirement for working on this in this particular role. Can you meet this requirement? In other words, are you vaccinated or do you have a religious or medical accommodation request? You're not asking them for additional information. And then we usually put a contingency in the offer letter that says something similar, that they'll need to comply with the policy. And then after you make them the contingent offer, you can get more into the reasons without as much consternation, but we want to keep the information that we get as employers limited to the information we need to know in order to make a decision on an accommodation request or know the next steps. But we don't want to ask for too much information when we don't need it. Accommodations for disabilities, we kind of started talking about this. This falls under the Americans with Disabilities Act. If an employee requests an exemption on the basis of a disability or because of a medical reason, the employer is required to determine whether the request can be accommodated. So the first step is to ask them to fill out a reasonable accommodation form for a disability. So you take a look at it and it says, I'm really afraid that this hasn't been tested and we don't know what's going to happen 15 years ago or 15 years from now with respect to side effects or long-term effects of vaccination. That is not dealing with the employee's medical reason for not getting a vaccine. That's a fear, right? So that's different than the employee has a medical reason that they're being advised not to get the vaccine. So your first step is it really a medical thing that is linked to them? Then you look at, can this request be accommodated? So would it be an undue burden, a significant difficulty or expense in order to accommodate that disability? So can we allow this person not to get vaccinated? Are there other things that we can allow this employee to do that would satisfy our concerns about the threat of them not being vaccinated to the workforce, or that would reduce the, that would allow them to essentially not be vaccinated and continue to work? If they're working from home, you might say, no biggie, just continue to work from home until we can't, if you have to eventually not work from home, we'll revisit your accommodation. But if they're working on site, you might say they'll be subject to a testing requirement. And if they're subject to a testing requirement, you'll have to determine whether the expense of possibly having to pay for that testing, or at least the time off to test, is an undue burden over a long period of time, right? Because most sites have these requirements that you get tested within 72 hours, have a negative test result within 72 hours of showing up on site. These are really case-by-case analyses, right? So you're looking at whether the person meets the standard for a disability or a medical reason for an exemption, and then whether or not you can accommodate them based on their job responsibilities. Can they really perform the essential functions of their job? Can they get on site? Do I have to pass this accommodation through a prime contractor or through the government? If a lot of folks, I've received several medical accommodation requests that say I need an accommodation form or I need an exemption from testing as well as from vaccination. And that's often considered an undue burden by employers to allow both, because the government is going to require you to have one of the two in order to get on the work site and work. So it's really an interactive process. You engage with the employee, don't just write them off, but we're going to look at things like, can we just tell you when you're around other people to wear PPE? Are there different work times or assignments? Are there telework arrangements that can be made that's not an undue burden and allows them to perform the essential functions of their position? You don't necessarily have to grant them the accommodation that they request. You have to engage with them to find a solution if it's possible to find a solution. And sometimes it's not. Sometimes it's just an undue burden and there's nothing we can do about it. So, but you have to engage in that process.
That brings us to religious accommodations or accommodations for sincerely held religious beliefs. It functions very much like the medical accommodations do. However, I will note that for the first time in my practice, religious accommodations are overshadowing ADA accommodations. And so for the first time ever, a lot of employees are taking this issue, probably because it doesn't require a medical note. And there are some issues with moral and ethical beliefs that really might touch on sincerely held religious beliefs. So let me talk, because this is a question that has been raised a couple of times. What exactly is a sincerely held religious belief? It is differentiated from a conscientious conviction or a feeling of personal safety. It really has to be something that is sincerely held, that is moral or ethical beliefs as to what is right or wrong. And it has to be elevated. While it doesn't have to be part of a specific religion, organized religion, it does need to be elevated to the level that individuals might typically hold a belief in a God. And so having a strong feeling is not necessarily going to be enough, but there are some issues with theological opinions and preferences that might factor in. So what we generally recommend is that employees fill out a form that requests a religious accommodation and explain the reason for that. Where there is no undue burden, a company generally has an obligation to provide reasonable accommodation. There is a caveat though. That is where there is a reason to have an objective doubt that the employee's sincerely held religious belief is in fact sincere, or to doubt that that belief actually prevents them getting a vaccination. There have been a few common threads that we've seen over the past few months that are common reasons for why an employee might request a religious accommodation. One reason has typically been that employees are against this idea of using a vaccine that was tested on or that used fetal cells in its development. Generally, this could be something that is a sincerely held religious belief and could be a good reason for why an employee might not want to get the vaccine. However, there are some follow-up questions that you would typically want to ask if someone comes to you with that type of request. One question might be, have you rejected other vaccinations based on this religious belief? Presumably, if you are against this vaccine for the reason that it's relied on fetal cells, there are other vaccines that you are similarly against and have objected to in the past. There are other medications as well that are sort of in the same boat when it comes to testing. And so you might want to confirm with employees that their reasons extend to those other medications as well, just to find kind of a consistent belief. There's no obligation typically under Title VII to ask these questions. However, this is a new circumstance because in order to grant a vaccination accommodation under this mandate, you can only provide it for two reasons: medical or religious accommodations. So when you're considering these accommodations, you want to make sure that the employee's request actually fits within one of those two buckets. Because if they don't, and it looks like you've just rubber stamped the religion of believing in rocks that Nicole raised earlier, you could be in an uncomfortable situation down the line if there is an audit from the IG, or if your CO does ask questions about certain individuals, if you can't point to at least a reasonable inquiry and a reasonable attempt to find additional information for why this individual maybe does have sincerely held religious belief. Unfortunately, this is one of those parts of employment law that is not clear cut, and there's a lot of gray area. So the important part is that you're asking questions where appropriate and documenting employees' requests and engaging in that interactive process that you would engage in with the same type of request for reasonable accommodation under the ADA.
Okay, state laws. There are a number of state laws. There aren't a lot of them, frankly. States have basically stayed out of this one for the most part, but there are a couple states that you need to be aware of. Generally, the executive order, when it does become applicable to your contract, is going to preempt that state law. The most, at least from our perspective, based on our initial look at this, basically what's the two big ones that you have to worry about are Montana, that prohibits employers from denying employment or discriminating against employees based on their vaccination status. But once this executive order is in a contract that affects folks in Montana, our assessment is that they will likely be preempted. Although I'll talk about ways that you can handle this with a contracting officer in a little bit. Florida really only prohibits businesses from requiring customers to provide documents. So you can't go into a restaurant and require someone to have to comply, but it shouldn't affect federal contractors really. Santa Clara, California requires employers to obtain COVID vaccination status, or they can, that's a little bit of the opposite direction of Montana and Florida. And then Texas is the new one. And they basically said, in addition to the religious or medical accommodations, you need to provide an accommodation for conscientious objectors and for, religious beliefs, medical reasons, or prior recovery from COVID-19. So there are expanded accommodation requirements there. But what you want to watch carefully here is making sure that you time this right with the EO's or the FAR provisions modification into your contracts. But we think that in general, the executive order is going to preempt these laws to the extent they impact you, primarily Montana and Texas. And in those particular cases, you'll want to tell the government when they modify your contract, hey, government, I could get in trouble with state law. You sure you want to do this? And if they say yes, then you proceed and you document it. But there are some laws out there you need to watch for, but we're not particularly worried about them.
That brings us to the end of our presentation. We covered a lot of material. There are some overarching takeaways. The first thing to know is that everyone is in the same boat. This is very confusing. As Nicole mentioned earlier, these were not the most clearly defined and well-explained guidelines. And so a lot of this is sort of a learning curve, and we're figuring out things as we go along. I suspect that December 8th will reveal a lot of procedural hurdles that maybe the government will make clear, maybe they won't, and just struggle through it. But the important thing to do is to remember to do the best with the information that you have, even if it is imperfect. The fact that we have a lot of questions out there shows that there are a lot of others out there who do too. This often will mean that contracting officers or agencies may fill in the gaps on their own. So you just want to be keeping aware of any updated guidance on a go-forward basis. I will note that the FAR provision itself notes that the guidance is subject to change, and that change will be incorporated moving forward. And so you want to make sure that you're keeping an eye out for additional updates as we go. You want to also make sure that you're making good decisions about how to roll out these mandates. If December 8th is the deadline following this grace period, does it make sense to apply the mandate to individuals on that date, or do you have some flexibility when it comes to how the mandate will be incorporated into your contracts? Just make sure that you're thinking through these issues. As always, don't be afraid to ask for help. If you have questions about how to proceed, it's always a good idea to reach out to your consultants or your legal advisors to see if they have some suggestions or current updates that might be relevant. And make sure that throughout all this, you're communicating with your employees and being clear about steps you're taking to keep them safe and steps that you are taking to ensure that you're complying with your contract obligations, but also any legal requirements that you have to them through ADA or Title VII obligations. And that's pretty much it.
I tried to answer most questions as we went along in the Q&A box. You know, we should have known that we were going to get a lot of questions, and apologies, but I think I answered almost every question except for a couple. And if, and I will try to, I believe we can get a copy of the questions we haven't answered, and we will try to reach out to you to answer those. I'm going to peruse these really quickly. I think we went over the religious exemption one. Keep in mind, there's a question about paid leave for vaccinations. That has not, those rules have not been issued yet. So right now there's no requirement to provide paid leave, but you might want to consider letting people use their PTO and checking state law to see if there's any state. A lot of this is covered under state sick leave laws to provide accrued sick leave for these types of things. And yes, this is frustrating, particularly on the religious side of things. There is nothing that's bulletproof. So what I'm telling my clients is have a process in place, go through the process. If it appears to be a sincerely held religious belief and you don't want to get into the mud with somebody, you don't necessarily have to, but you need to have a process and exercise good faith in processing these. Most of these exemptions you can push back on, I think, legally. The question is whether or not you really want to have to do that, if you want to have to terminate somebody, but you do need to proceed in good faith through these, and you are not required to verify that somebody goes to church every Sunday, right? That is not the requirement. It's something less than that. This does not apply outside of the United States. So if people are working outside of the United States, employees working outside of the United States on facilities do not have to comply with this. And then we got a question about if vaccination status is considered medical records, why do you have to present that to the employer? Because employers can request medical records from time to time. There's nothing that prohibits an employer from requesting a medical record if they need it for some reason, right? You don't want to do it willy-nilly, but HIPAA does not. This is a longstanding miscommunication with respect to HIPAA. HIPAA doesn't cover this kind of stuff. Right. So the employer can request it, and then under the ADA, they need to protect that information. So you always want to be careful with it, but in these particular situations, you can request it. And that's basically it. So I think I tried to kind of scoot through them. I really appreciate everyone's time today. And if you have any questions, just let us know.
Great. I want to really thank Nicole and Sarah. I know this is just a great deal of information. I want to thank you for your time. I know how valuable it is. Just thanks to you and the great team at Pilero Maza. We always appreciate all your support. I know we went over a little bit, so I appreciate you hanging on and staying with us. Thank you to the participants as well for attending this VIP VBOC webinar, and to the SBA for making this webinar possible. I want to just ask everyone to take a moment to please complete the very short survey that is going to appear on your screen immediately following the program. Your feedback is obviously very important to us, and it's how we can continue to provide these informative VBOC webinars. So thank you again, Nicole, Sarah, really appreciate it. Great seeing all of you, both of you, and our regards to your great team at Pilero Maza. We wish you all continued success, and we hope to see everyone at the next VIP VBOC webinar. Thanks again.
Thank you, guys.
By the way, everybody's going to be receiving the slides, the recording, and the Q&A via email tomorrow. Okay. Thanks, everybody. Take care.